मक्कारी की जमीन पे हुए गद्दारी के पौधे, इससे पहले मैं तुझे ईमानदारी की खुरपी से निकाल के बाहर फेंक दूं।
अरे क्या मुझे याद आ गया भाई। लाइक दैट।
मैं लड़की का बाप हूँ, और एक बाप महज एक बाप नहीं होता है। बाप एक अहमियत है, एक किताब है जिसका हर पन्ना जिम्मेदारी की स्याही से लिखा गया है ना। बाप सिर्फ एक लफ्ज नहीं है, उसे परवरदिगार बनाता है जो बनाता है। एक बात याद रखना, बाप वो सरजमीन है जिसके ऊपर औलाद नाम की फसल को बाप अपनी कुर्बानियों से पानी देता है। वाकयात की जो कड़ियाँ मेरे जहन में उभर रही हैं, उनको मद्देनजर रखते हुए अपनी जिंदगी के हालात एक बाप के लिए सुना तो मेरे लाजिम हो गया। बेटा अगर चाय है तो बाप उसकी टपरी है, बेटा अगर छपरी है तो बाप उसकी छतरी है, बेटा अगर ट्रेन है तो बाप पटरी है, बेटा रुमाल है तो बाप गठरी है।
मैं पहले अपनी बेटी के रिश्ते की बात कर लूं, उसके बाद तुम पे आता हूं।
भाईजान हीरा
बरखुरदार, क्या लड़का ढूंढ रहा है? अबे हट, ये लड़का है? ये लड़का नहीं है? ये देखो ना, ये प्रॉपर गेंडा है। इसकी पूंछ नहीं है, इसके सींग नहीं है, ये फिर भी प्रॉपर गेंडा है। कोई भी लड़का मेरी बेटी के लिए परफेक्ट नहीं हो। उस दहलीज पे खड़े हैं जहां अंदर जा ही नहीं सकते, नाकाबिलियत की दहलीज। प्रीलिम में रह गया, ये वाइवा नहीं क्लियर।
Day 1 of studying 1 second for each subscriber I get. Today I have 2770 subscribers, so I will be studying 2770 second, which is 47 minutes and 10 seconds. Asthma and of CO2 and O2 in the COPD and start coverage. The basis of chronic bronchitis. On the basis of it is defined as permanent enlargement of respiratory units, airway, distal terminal bronchi, respiratory bronchioles alveoli. Emphysema is the enlargement of the emphysema. Chronic bronchitis 3 months for at least 2 consecutive years. Bronchiectasis. 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 Permanent dilation of bronchi and bronchioles due to destruction of their walls caused by repeated nitrotizing agent. Thus, the reproductive cough for more than 3 months for at least 2 consecutive years must rule out other causes of bronchitis. Chronic bronchitis is diagnosis of exclusion respiratory unit from smoking. Most common cause is smoking, phenotype deficiency, alpha antitrypsin deficiency. Yes, trypsin deficiency empphysema can cause. So, there are 2 types. There are 2 types of antitrypsin or smoking. Last one in echinal, one was another one. Lung elasticity decreases in cardiovascular and anti-elastic activity. Free radical increases. Centri-echinal emphysema, also centri-lobular emphysema. Proximal part of the respiratory unit, proximal part. Common in smoke. Periechinal or distal part of the respiratory unit is involved. Bulla or Echinus, a whole respiratory unit is more common in alpha antitrypsin deficiency, lower dose irregular emphysema. Central echinus, upper lobe, proximal part of the periechinus, distal part, panichinal, whole. Pink peppers. Pink peppers are emphysema. Dyspnea and most common dyspnea is pneumonitis is the most no wheeze sound. Emphysema due to use of excessive muscles of respiration. Lean and thin. Pursuing stimulation. State expiration slowly. First lips. Pink peppers. Blue blotters. Blue blotters chronic productive cough for 3 months. I will tell you. Wheeze which shows cough, which clears with cough. Wheeze which clears with cough. Late feature is cyanosis. Weight gain due to edema, bloaters. And weight gain due to edema, that's why they are called bloaters. Peppers, blue bloaters. Barrel shape, a wheezing that clears with cup. Pink peppers, it seems to be the suggestion from hyperinflated lungs. Hyperinflated lung depressed and from tubular heart. Hyperinflated lungs and dirty lungs. Dirty lungs, secondary polycythemia. Hyperinflated lungs. Hyperinflated lungs only these hyperinflated lungs is the define is permanent enlargement of the respiratory unit at the airway distal to the terminal bronchioles. Enlargement severe hyperinflated cells. Permanent enlargement of the respiratory unit or airway distal to the terminal bronchioles. Smoking, antitrypsin, alpha-1 antitrypsin deficiency, alpha-1 antitrypsin deficiency. Hyper or dirty lungs, bronchitis, chronic bronchitis, dirty lungs. Pulmonary function test. Pulmonary function test 80%. 70. Give bronchodilator subcutaneous speed. Improvement. Asthma improvement. It will give the broncho investigation of choice. Bronchodilators and vitamins will give E1 V1 ratio obstructing 70%, 12% deforming. FEV1 divided by FVC, there was 70% obstructive disease is the बिल्कुल 70% कम हो 80% पर normal thing. खुदा bronchodilator सर bronchodilator salbutamol सर 15 minutes बाद चिकन देनो दाबा bronchodilators salbutamol करो कि 15 minutes wait और कि अग्याबा दफा PFT ratio पर repeat की यदि कि 12% improvement रखा जो जब asthma तो 12% improvement no रखा ना हो that's COPD. This is very important investigation of choice. treatment FE1 salbutamol, long-acting beta antagonist, LABA, salmeterol, long-acting salmeterol और LABA का 50% रेशो कम हुआ ब्याबा salmeterol वर्को दवा दहन कम हुआ LABA और ICS और ट्रोपियम LABA inhaled corticosteroids और ballicity addition mycolysis and acetylcysteine mucolysis diuretics epidemic beta antagonist GABA long acting LABA plus long acting salmeterol और 50% में कम हो गया फिर दादा 50% में कम हुआ ज़्यादा हुआ न गया सिर्फ LABA वर्को LABA plus ICS वर्को और खुदाल का 50% कम हुआ न गया LABA ICS और एप्रोटोपियम लॉन्ग टर्म ऑक्सीजन थेरेपी if MCQs maintain saturation 85 to 92%. Acute exacerbation of acute exacerbation of COPD, breathlessness, septum volume, increased breathlessness. What is the most common organism? Bronchitis, propagation, bronchi. Conducting zone anti-colonoscopy, blue blotters are chronic bronchitis, pink peppers are emphysema, exacerbation of salbutamol and nebulized infection. Acute exacerbation of COPD, increased breathlessness, septum causes infection, nebulized salbutamol and epratropium. Send ABGs and chest X-ray saturation of 80%, give oxygen 24 and maintain 82 to 93. Injection hydrocortisone, 2 steroids, hydrocortisone. No response, nebulized gives aminopylene, no response from MCQs that is chronic smoker. The chronic smoker chronic produce cough from 3 months having it and the last 2 years in chronic bronchitis, sinus, ventricular hypertrophy, right chest X-ray, right ventricular hypertrophy, and acidosis. This is no improvement other than bronchodilators. In chronic bronchitis, bronchodilators are asthma. This is the patient and this the barrel shaped and the patient is having jaundice, chest hypertrophy, hyperinflated lungs, tubular chest X-rays having jaundice. Patient is having jaundice and hyperinflated lungs, tubular heart and depressed diaphragm. Tubular lift bilirubin increase, ultrasound shows liver cirrhosis. Then liver Kudam Pakiravan, the other antitrypsin deficiency causing emphysema and other antideficiency trypsins, abnormal excessive condition both for alpha-1 trypsins or alpha decreased antitrypsin deficiency, liver cirrhosis, lungs elastic activity increases. Emphysema in young is think about antitrypsin deficiency. Emphysema in young age, think about antitrypsin. In smoke 20 years, bronchiectasis. Bronchiectasis equals bronchiectasis. Abnormal and permanent dilatation of bronchi, bronchiectasis, permanent dilatation of bronchi. Ectasis is bronchitis is the blockage of the chronic productive duct, जिसे हम blockage कहते हैं. Exclusion. Permanent dilatation, bronchiectasis. Ectasis means permanent dilatation. Ectasis means dilatation. Ectasis, bronchus. Due to destruction of their wall caused by repeated necrotizing infection. Children, chikunde, Cartagena syndrome, cystic fibrosis, young congenital or acquired infection, the TB, measles, or foreign body. Most common cause in Pakistan is TB. Most common in West USA is cystic fibrosis. Infection, TB. Infection, TB, infection and TB